Hello.
Hi, how are you?
Fabulous. How are you?
Doing well.
Good, good. Awesome. Well, thanks for doing this. I think it's going to help some people. So,
Absolutely. Happy to help.
yeah. So we'll go through and just kind of talk about, whatever you think, because you're functionally trained, you've got all this stuff. Um, any of this type of stuff, I don't think talking about, the idea that antibiotics are overused is going to be too earth shaking for too many people, but it's something I think we should definitely go on through. So,
Okay.
um, but we'll go through. Is there anything specific that you definitely want to make sure people know about?
Um, I was just going to I was writing some things just to address the questions you had. And then you wanted to make sure you put in there something you told me about. Oh, just making sure parents, if I want to throw in there, allow vaccine choice or at least respect their choices.
Yeah,
Um,
I want to be really, really loose on however you want to play that.
right.
As far as those questions go, if you want to be like, hey, let's not talk about vaccines at all, we can completely avoid the topic. But I know that that is one of the things that people are the most, especially right now, or they are the most, they're asking the most questions about.
Right. Yeah, I
So,
mean, I don't mind just mentioning it, at least saying, choose somebody that is going to partner alongside you, you know,
okay.
in your
All right.
choices. So,
All
okay.
right. We can
Anything
get to
else
that.
you want me to make sure is in there?
No, no, like I said, I just want to make sure that, if there was something you're like, hey, I see this thing every day, and like every pediatrician can figure this one out. Like, but here's an issue we see a lot. Um, those would be the things I want people to be able to hear about as, you know, because I see a lot of people like for the ear infection thing is an irritant for me. Because like, oh, we'll
Right.
put you on antibiotics. I'm like, if you'll just get that adjusted, it'll fix it so much faster.
Yeah.
And you
Well,
want
I
to destroy
definitely
their
see
gut.
that. And like you said, the overuse of antibiotics, I love obviously recommending the chiropractor. And I definitely could mention 65% of ear infections are actually viral. So you don't need an antibiotic.
Yeah, so that would be that. I'll ask you specifically about that too. So,
Okay. Okay.
all right, well, we'll run through it real quick and we'll get everything going. So,
Okay.
all right, and we can edit out the things we don't want. So that's always good. So, well, thanks for joining me. I wanted to have, out of all of my professionals that I know, I had to have Christie on, Dr. Potter on, because, as far as the pediatricians go and as far as kiddos go, you are by far the person that I lean on the most. It's funny whenever people ask me questions like, how do you know so much about pediatrics? I'm like, I don't. I just have really smart friends. So that's always been beneficial for me. So, Christy, if you'll do me a favor, kind of tell everybody kind of who you are and the practice you run and kind of how you do that type of stuff, and we'll kind of start with the introductions.
Sure. Thank you. Thanks for having me on. Happy to help. So I am a pediatric nurse practitioner. I own a practice locally in the area that focuses more on holistic, natural-minded approaches in treating kids. So I love peds. I've been working in pediatrics as an NP for well over, I'm almost 20 years now, and it's definitely a passion of mine. So I love the health outcomes in my patient population compared to when I worked in more of a traditional approach to pediatrics. I see the health outcomes are vastly improved and vastly different. So definitely a big passion of mine.
So, real quick for people, what is the because people use the term holistic. I tell you usually improperly. So, kind of give everybody kind of a rundown of the difference between a normal medical pediatrician and a pediatrician who has the functional medicine or the holistic training as well.
Sure. So traditional pediatrician usually, or traditional healthcare providers usually have one or two things in their toolbox. They can use, medications, or they can refer you to specialists. Oftentimes, a lot of them are specialized and can do a few more things. But in a holistic world or holistic approaches, they usually look at the whole person, the whole child. So we will a lot of times utilize other modalities in treatment. So we'll use homeopathics, essential oils, supplements, vitamins, other healthcare practitioners oftentimes involved in the treatment protocols, things like that. So it's more of a holistic approach. Sometimes we use medications if we need it, but we really try to kind of have a foundation of just looking at the whole child, the whole patient, and treating appropriately based on that.
There's a there's an idea that is starting to kind of percolate up that the holistic, more natural community has been saying for a while about the overuse of antibiotics. And I always like to preface this with like, I understand that antibiotics have saved millions and millions of lives, but that doesn't mean that everybody needs them for every sniffle. So, just from your standpoint, when you see kiddos, as far as the antibiotic stuff go, how overused do you normally see that being, and what kind of dangers does that pose to a child?
Yes, this is a pet peeve of mine as well. I see this all the time. I feel like a lot of times pediatricians, healthcare providers, they feel a pressure to write a script, write something. The parents want to have something to do at home for their child, but it is not always necessary. 65% or more of ear infections are actually viral. So you're writing a prescription for something that's a virus. Antibiotics are used for bacteria. So it's definitely overprescribed, overused, and there are lots of other things that you can do for ear infections. Sometimes at our practice, we will use, other holistic things like homeopathics, herbals. We recommend chiropractic approaches. A lot of times, if you can get their neck and ears adjusted in a very gentle way, that can help clear out the ear infection. There's lots of approaches, but antibiotics is definitely there as an option if you need it, but it is overprescribed for sure.
So when we see these kiddos who have more issues with any long-term issues that you've seen with antibiotics, I know the research is coming out and showing major depression issues and yeast overgrowth and things like that. Have you seen any issues, that you've had to deal with from, other kids who came in with too many antibiotics that transferred in your practice or anything? Have you seen any long-term damage from antibiotics?
Sure, absolutely. I see, even some eczema, you can see some things in the skin that it's an itchy, chronic, itchy, uncomfortable skin condition, lots of frequent or long-term diarrhea. The thrush and yeast issue is huge for sure, stomach aches and pains. They don't sleep well. So there's a lot of side effects to antibiotics if they're not used appropriately, that or overprescribed that can definitely cause some long-term issues.
So, what as far as diet plays in, like how often do you see the issues that the illnesses, the issues kids are having, is not so much a viral bacterial, but it's more of a dietary problem that they're just not getting the stuff they need.
Yes, sadly, our diet in the United States is not the best. We don't have the best quality food, unfortunately. I don't really love all the things that they spray on our foods, or genetically modified. I know a lot of people have heard that, and that's big news and stuff too. But really, organic, whole food nutrition. A lot of times, I'll tell parents like, look at the ingredients in the food. If you have more than 5 ingredients, it's probably not the best choice. I mean, you can't always do that, but 5 or less ingredients, you can kind of be pretty healthy there. Just kind of pay attention to healthy whole food nutrition. Your local farmers, if you have access to that, is definitely a great thing too. Lots of farmers markets and stuff.
So, how many pediatricians are functionally medicine trained?
Oh, that's a good question. I don't know if I have an exact number, but I know, I mean, there's probably, if I was to guess, maybe a few thousand in the United States total. Not as many as people would love to see. It's a huge demand, and definitely would love to see more pediatric people functionally trained, but it could definitely be more.
I guess I should ask because I know what that is, but lots of people
Oh, good. How
don't
many?
know what a functional medicine doctor is. Can you kind of walk into like the additional training,
Oh,
like
okay.
what's involved and all that type of stuff?
Um, so it depends on the route you go. Some people kind of learn along the way and they go to conferences and, lots of additional training along the way. Or you could do things like there's the IFM or different organizations, like in pediatrics, there's a group called MAPS, MAPS, which is pretty much pediatrics for special needs kids. But it depends on which route you go. IFM is Institute of Functional Medicine, and that's an official training approach that you can get. You have to do it after you graduate from any of your medical schools or nurse practitioner schools, things like that. It's an additional after the fact training.
So how long is that training if you're going to complete the whole thing?
It can be a few years sometimes. They usually have internships and things like that. So it's definitely a lot of extra commitment that way as well.
So it's basically going to med school all over again.
Right. You don't really want to continue after all the years that you go to school, continuing on even more schooling. But that's why I say, and I started out by saying, I think it has to be a passion. It's something that people really, it's a lifestyle choice sometimes for a lot of healthcare providers, that they see that in their lives and their children, and they want to, share that with their patients, or they see kind of the way that the traditional um, medical world functions, and they see a lot of problems with that, and they don't, it just doesn't sit right with them or feel right with them. So they start asking
So
questions.
And those can be really good. And, sometimes a little dangerous, but those are also like, those are your best guys. So is there a difference that you see between the philosophy of functional medicine um, and traditional medicine?
Yes, the biggest thing I see is just the root cause. What is causing the issue? Can have a patient that comes in with multiple ear infections or chronic eczema, skin conditions, but why are they having that? Are we having an overgrowth of yeast, or are we having parasites? Are we having toxins? Are we having too much dairy products? Cow's milk dairy products can sometimes cause lots of mucus, and the kids can have infections or allergies. What is the cause? We need to kind of delve in further. So I would say that's the biggest difference, is just figuring out root cause, medicine or healthcare approach.
So the typical medical is more, and this is, I want to make sure I'm asking this question because this is my bias. The typical medical is find a symptom and then cover the symptom up with a drug, versus the more physiological issue of what in the chemistry is broken that we can go in and fix. Is that more or
Yes,
less?
absolutely. That's
Okay.
absolutely correct.
Cool, cool, cool. So like, with the rise of guys like Gary Brecka and, the guys who are coming out and giving all this physiology and all the DNA and all that type of stuff of, inflammatory systems and, you know, damage we've done to ourselves with the chemicals on our food and, accidental damage from medications and things like that. This would be more of a, if you're looking for that type of thing, you're looking for a functional medicine trained doc.
Correct. Yes.
Okay.
Somebody that's going to look at the root causes, whether they're officially functionally medicine trained or they just have a lot of experience in it, or they really, that's a big passion, and you feel comfortable with those approaches. Absolutely.
So if we're looking at, because I know a lot of people have the long-term eczema, they have, the autism is such a gigantic spectrum now with ADD and all that type of stuff. So because you've gone through the training, is there outcome result that base? Is it better for a functional medicine trained person to be treating these long-term issues like autism and eczema and psoriasis and these reactions, or is there typical medical routes that are actually working?
I would say the better outcomes we see are definitely with the functionally trained approaches, for sure. I mean, you can, see your traditional docs, but usually you're not going to have like, groundbreaking changes, and I don't want to, put down traditional docs. There are some great ones out there, but they just don't know. They don't know. They don't have the training. They don't ask the questions sometimes. And I feel like you could make such a big difference in these families' lives and the health of the child if you can kind of get more to the root causes and fix some of those. There's huge gut brain connection and the microbiome, and that research has definitely been out there a while and up and coming, and more and more we know over the years. I definitely think there's a lot more that can be done for these children and patients.
Yeah, there's a lot of like the new research that's coming out, and it's always funny because like we have new research. I'm like, oh, did we just do this? No, this was done 30 years ago, but we're just
Right.
telling you about it now. And I'm like, what? What? So, but like
Well, I know
the
you've been screaming that forever. You're like, I've been talking about the gut forever. I mean, I've known you for so long. I'm like, yes, it's been out there. People just don't, I don't know if they're just not ready to hear it yet, or maybe we have to say it 200 times and finally they see it. It's hard.
well, maybe that's it. I don't know, but it's funny because it's always one of those things where I feel like the parent who has been saying things to their children for years, and then like someone's also like, you should drink some water. And they're like, maybe I should drink more water. And you're like, oh my, 10 years I said
Yes.
that. But
Yes.
like the gut thing, like when they're coming out and the new research shows that, when people have, young people have too many antibiotics, it creates depression later. And you're like, yeah, all your serotonin's made in your gut
Yep.
by your probiotics. If you don't have any bacteria in your gut, you can't make serotonin. So obviously you're going to be depressed. And it's like, this is not new
Yep.
news. This is how the body works. But I'm glad that it's kind of starting to come up because
Become
like
more mainstream. Sure.
yeah, because we'll have parents come in, they're like, hey, kid has X, Y, and Z. We don't, the pediatrician gave us an antibiotic, but we want to do something else if we can. And so, lots of times we'll be able to give them, Allison or titanium or whatever. And, they're like, oh, they're better now. I'm like, great. Or at least that the other thing is that I feel like, and this is, again, I've got lots of soapboxes on this, but um, if your doctor's going to prescribe, let me ask you this, since this is kind of a you thing. If your doctor prescribes an antibiotic should you at least ask for an antifungal and a probiotic to go along with it?
You definitely should at least ask for a probiotic minimally. Yes. A lot of times they won't necessarily write you an antifungal, but if you have the right appropriate probiotics, that can help protect the gut for sure. Absolutely. But I just think everybody, they're on their own health journey, right? They don't, it's hard to trust people, and the medical establishment is kind of let us down over the years. And I think people are starting to realize that and feel more comfortable asking questions and knowing, kind of in their gut. Parents have a great gut, they know, when something's not quite right with their child, and eventually they will start asking the questions. So,
It's always been funny because moms will bring us in people, their kiddos, and they're like, something's not right. And it always irritates me. They're like, I went to our pediatrician. I told him something wasn't right. They
yeah,
looked at him. They just sent him off. Like they told me I was fine. Everything was fine. And I'm like, I have never known a mom to be 100% wrong. Like it might be like, oh, we figured out what it is. It's not that big of a deal. Sometimes it's like, hey, they have a slight sensitivity to the food you're feeding them. So we can either desensitize them or you can quit feeding them that food. But that's what's causing the extra gas. It's not that huge issue. Or lots of times it's, oh, this is actually a pretty big deal. Like
sure.
they can't have XYZ, or they need these extra nutrients. Like, there's a lot of, B vitamin issues that these kiddos need that, well, a lot of the docs, like you said, just haven't been trained on. So, the idea of not listening to the moms when they come in and they tell you something's wrong, I'm just like, no one knows that child better than their mom. Like if you're going to start dismissing what mom says, you should find another field to be in because mom knows best.
Absolutely, 100%. And then you just have to find a practitioner or provider that you can establish that trust. You want somebody to partner alongside you and walk that journey with you, that you feel comfortable asking questions. So many times I get parents in my office and they say, like, I couldn't even have a conversation about certain things. And, that's just disheartening and frustrating. And it just goes to show like it's just a one-sided, it's not a one-sided healthcare approach. You want to seek out a pediatrician that is going to support you in your choices and be willing to have discussions with you. And it keeps us on our toes, in the pediatric world. We want to stay up on the research and we want to be able to answer those questions. And I feel like it's, disappointing if you can't even have the conversation with your provider.
But yeah, I think one of the issues we run into, and this is something I see with the adult doctors as well, is you know the medical your medical group gets so little actual education in physiology and nutritional biochemistry and supplementation, and it's I feel like it's hard because when you start asking them these questions, it's not that they don't want to have the conversation, it's that they don't know any of the answers, and so there's nothing they can do, which is, I think, scary and problematic. So what ends up happening is that these parents are starting to look, Google on their own, which the Google on your own thing is, I always love that because, and I realize a lot of docs hate that. I like it because it's like, look, you care enough that you're going to start doing your own research. The problem we get into with it is that not all answers that come back with AI, or not all questions that come back on Google, are 100% accurate. Um, but I love it because people are like, well, when I Googled it, this is what it said. And I can go, well, okay, that would be accurate in this instance, or this isn't accurate at all. Or, yeah, that's right. Go ahead and do that. And so, that's beneficial. But they're like, well, I asked my doctor and they wouldn't even have the conversation with me. And I
Yeah.
don't know how much of that is, I have to see 26 people today in order to make enough money to pay my rent, or I don't know anything about this topic. And so I can't talk to you about it. Um, or I just don't care. And I don't know which one of those it is, because I think there's a healthy, breed of all those, because the way insurance has got us all stacked up, if you want to make sure that you're paying all your bills, you've got to do exactly what insurance says, and you've got to make sure you see, it's volume of people and not quality of care, which is irritating. But I think
Yeah,
that's where a lot of this,
absolutely.
all this, I'm not going to answer your questions, or I also think it's a giant lack of just knowledge, because I talk to these guys, I'll talk to them, like I have several medical buddies who will text me and be like, hey, a patient asked about, lysine for viruses today. Is that a thing? And I'm like, yeah, yeah, that's the best course you could use for any virus. I, I'm sad you don't know that.
Right. Well, I think they
But
say they only get like maybe a half a day, in medical school, a half a day on nutrition. It's really pretty sad. So I think you're definitely onto something, as if they even have the knowledge base, and do they have time to address it? It's amazing when I come across people that they say, "Oh yeah, my eye doctor actually said, do this," and it's something that's like natural or holistically minded. I'm just like, "Oh yes, I need to know these people." You want to build the team around you because you want to refer to people and have a network of people that are kind of like-minded. So I always love that.
well, my whole goal is, I just want to find the people who care enough to sit at home and read on their own. Like, don't, what your school told you is great, and what your pharmaceutical rep told you is great. But why don't you go start asking questions and reading some stuff on your own? The people who are looking to do those things, like yourself, like who are dedicated to, I have to find all the ways of helping somebody. Like the way it worked for me was when people would come to my office and I either couldn't fix them or I didn't know where to send them, that really bothered me. And so that was one of those things where like, well, fine. If nobody else is going to do this, if I can't find anybody else, wake up at 4 and I'll read all the research. And so finding a team, that's one of the reasons I wanted to do this is because, you know, now people know to look for functional medicine. Now they know to look for IFM certifications. Now they know the kind of the differences. This is the type of idea. If you're looking for a better level of education, a better level of care, you need to know what you're looking for. And so, we can develop teams of people who are looking at these things and trying to expand their personal knowledge so they can treat people better. That's why I wanted to get some of you guys on and be like, this is what you guys need to be looking for. So, that's the whole kind of purpose of this was, what kind of doctor should we be looking for? Because, we can sit here and we can come up with ideas of things, and everybody has ear infections, and everybody has, like, colic is an easy thing to fix with adjusting manipulation. But there's a lot of little things out there that people just don't know that they should be looking for. The idea that your pediatrician or your doctor should be, part of your team and should be listening to you, I think is also unfortunately lost for a lot of people. So, I
Yeah,
mean,
absolutely.
I know you guys use a decent amount of supplementation for your kiddos to boost immune systems. Is there anything specific? Like, what are your favorite like go-to supplements for just general health?
Sure. I mean, I love vitamin D. I feel like a lot of people are definitely lacking. We can always use, some vitamin D supplementation, any kind of things that, especially through the winter, that are going to help boost immune system, including probiotics, omega-3 fish oils, like some really good quality omega-3s, multivitamins, but I say quality multivitamins. A lot of people sometimes purchase at their local drugstore or sometimes online, but you don't always know the sourcing of those and where they're coming from. So if you can find some good trusted places to purchase supplements, that can really help. But those are some of our favorites, that we like to use as well in our office.
So, how dangerous is sugar? Because I know we're talking a lot about that. So, how dangerous is the sugar that you're seeing with your patients?
This one I think is probably that one's a a hard thing to approach in kids, because I think our food that we have in the United States is packed full of excess sugar, and it's designed to be addictive for these kids, and it can create so many health challenges, including yeast and candida and yeast, skin things, gut problems, sleep issues, hyperactivity. When you see a lot of ADHD stuff, even emotional, I guess, what do you say? What's the word? Emotional, like I would see a lot of in some anxious kids, or anxiety and depression. You see that, and a lot of these people actually have crazy high sugars and they just don't feel well. They get headaches, physical ailments that way too. But sugar is way too much in our diet on a daily basis. They hide it in everything, and they call it
So,
50 different names.
yes, yes. The we're talking a little bit about some of this stuff. Everybody's freaking out about the RFK stuff, and it's like they're going to take the dyes out, and things aren't going to be the same color, and they're going to taste different. And people have been, I've done a dozen radio interviews on that. How bad are some of these dyes? Is it one of those things we should really start working on and pulling out, like that you see with kiddos? Like, how bad are some of these dyes for their brain and for their body?
Yes, they should not be in our foods at all. They're terrible for people, not only kids, but terrible for people in general. They're banned in many other countries. I mean, we have, like, I think it's like I saw 400 chemical, maybe more of that, 400 chemicals in our foods in the United States that they don't even allow in other countries. It's crazy numbers. I mean, the food dyes are just horrible. I don't care if there's yellow dye in my pickle. I just want a healthy pickle, right? Like nobody cares there's dyes and things that you don't even think. I found it in a pie crust the other day that shouldn't even have a color at all. I mean, it's sad and it's ridiculous. And I totally agree. We don't need any food dyes. I don't know if you've seen all the big, things with Kellogg's, and they're really trying to get them to take their food dyes out. I think it just starts with one big food company like that, and we can hopefully make a big difference and go towards that for all companies in the US. We shouldn't have those at all.
So I know that people are talking about seed oils are being really, really bad for adults. Like how big of a deal is it on a developing system to have seed oils and stuff like that in it?
Sure. Well, kids are really sensitive too. And I start to see a lot of families, it's in a lot of the processed foods. And I see a lot of kiddos starting to have kind of that, we call it like central adiposity, like on the middle section, the abdomen and middle section, starting to kind of have bigger and bigger guts. A lot of times kids are real thin if they, they're busy and active and all that kind of stuff. But you kind of start seeing a little bit more and more of that with gluten and seed oils and things that they're consuming. And I think long term, it's going to wreak some havoc on us. Like if you look at pictures back in the 50s, 60s, 70s, the body types were so vastly different before they put a lot of these things in our foods. And I think it's just a complete different, almost a population. Like you wouldn't even know these are people in the United States, back then versus now. It's pretty sad.
So maybe not in your practice, but how how big of an issue is the obesity issue, and how, like, because I see the way I see it, I tell patients, it goes obesity, diabetes, dementia, like that's the path you're on. How big of an issue are you seeing it with kids that you're seeing, or kids in your area with the obesity issue? How big of a deal is that really?
I mean, we definitely see it for sure, but it depends on, the factors of the family dynamics with the food, I think is a big issue. And I definitely agree with that. You're going to see that if they're overweight and obese in childhood, it's the numbers are statistically they're going to be obese and have the diabetes for sure, at least by early adulthood, and into exactly what you mean, what you're saying, dementia and those kind of other challenges. I do see that. But I hear a lot of times parents say it's such a challenge. They always eat this stuff at school, or they go to their friend's house and they want to eat the junk food there too. So it's so hard. I think it's definitely a challenge, not as much as adults, but we're starting to see a lot more numbers shifting in children over the last 10 years than we did before.
So, and the other one that I always like to point out, because when I talk to parents and they're like, I don't know what's going on, I'm like, your kid's under a giant amount of stress. And they're like, what do my kid have to be stressed about? So, like, it's always like, it's different. They don't have the coping mechanisms, and they have social media and you didn't. So how big of an issue are you seeing? I know you work with a lot of younger kids, but in these 12 to 20 year olds range, how big of a deal is the psychological stress on these kids, that, as far as their health in that manner goes?
Well, actually, I get to see it because when we do wellness exams, we have them fill out some mental health screenings, and we kind of get to see and track, what's going on with them. And the social media is huge. And I even saw a thing, I think this week, about Australia possibly looking at banning social media under the age of 16, based on research, which I think is great. But even down to infancy, under 2, they say children shouldn't have screen time. And these kids are spending a lot of time on screens. And that developing brain, which goes all the way into, the early 20s, is really being affected by that. So even into the teens, to answer your question, all that, the pressure, the social media, the screen time on their brains, really affects their sleep. It affects their functioning and attention at school, their self-esteem. There's so many factors, just from social media alone, that I think really makes a huge difference in their health. We're getting ready to do something in the spring where we're looking closely at social media and how that affects. We're going to do kind of like a research project at our office to look at that. So I'll get those numbers back to you at the end so you can kind of see what we found. I think it's going to be really interesting to see how social media and screen time affects the teenage and adolescent patients.
That is that's gonna be a good study. I'm excited about that coming out. I think it's funny because I talk to parents all the time, and like you say, they're like, I know it's not great, but I don't know what to do about it. And so, we'll have to figure out like one, how to dial it down, and two, how to remedy the issue.
Sure.
I'm a big sports person. Like, go out and be active. Like, go find something, because that's what I did with my kids. I was like, you can do any sport you want, but you have to do a sport. And you can do any artsy thing you want, but you have to do something in artsy. So music, theater, whatever, because I want both of those things. I want you to be able to be developed in both of those things. And so that's been beneficial for us. Um, you know, but it's one of those things where it's becoming more and more difficult, I feel like, to be a parent, because we have more stressors, we've got more things, we've got more stuff we got to deal with, and there's a whole lot more things that we have to avoid. Like, when we were kids, like, back in the day, we had a whole lot less chemicals in our food, and so that was better. I don't know when they stopped doing it, but McDonald's even had healthy French fries. Like, they were frying them in tallow, which I hear there's discussion they might go back to doing, which that'd be fantastic. Um, but there's a lot against us and against our kids right now that, I think if we don't start choosing our healthcare providers a little bit better, somebody who's going to sit down and again, this is a soapbox of mine. I tell people that, like, if there's one term I think we need to really sit down and define, it's healthcare provider. Because if you go to your doctor and they give you drugs all the time, they're not a healthcare provider. The person who's giving you the diet information, the exercise information, the anti-stress, watching your sleep, watching your hormones, you know, those are the type of things who are like, that's how you promote health, not necessarily with pharmaceuticals. And so, getting the functional medicine training, getting that type of stuff, seeking people out who are functionally medicine trained, being willing to pay extra for it. That market, I think, the more we grow that market, the more I think a lot of the doctors will go, oh, maybe it is a thing that I should start leaning into and doing. And, you know, I don't see, maybe you can correct me if I'm wrong on this. I don't see the medical schools or the medical establishment teaching more diet and supplementation function because, and again, maybe I'm wrong, but I feel like most medical education is entirely pharmaceutical driven. It's basically like, problem, symptom and pharmaceutical, symptom, pharmaceutical. It's not, there's no other options for these people than just, we're going to teach you how to sell pharmaceuticals. And so you're going to have to start finding people who've taken it upon themselves to get secondary training and how the body actually works and what to do. So that's why I wanted to, talk about the functional medicine stuff. Because now that people know, one, there's not a whole lot of docs out there who have actually gone through the process, actually gotten trained. And so you need to find, that's what you need to be looking for if you want more options. If you want, the standards, status quo, what every other kid's getting, which is, I think if you look at, again, that's my opinion, if you look at the trend in healthcare, the trend in allergies, the trend in long-term disease, the trend in we are the least healthy country in the world, and we're one of the richest countries in the world, and we're getting worse every year than we were the year before. We got to figure out what the problem is, and that maybe it's the fact that we're too pharmaceutically driven.
Yeah, the chronic disease is huge. It's ridiculous and it's getting very out of control. I mean, we used to have our medical schools before we had drugs and medication, they were, homeopathically based. We used to have homeopathic medical schools and hospitals, and I think in Europe now you can only still find three. There's three homeopathic hospitals where they'll actually incorporate other things into their treatment protocols, and the outcomes are fantastic. But it's I think unfortunately like what you mentioned, it's more financially based, and it really you have to follow the money, as they say, right? And look and see who's funding the schools and things like that too. So it's not financially beneficial sometimes when you can give certain supplements and homeopathics that are like $8. It's really it may work fantastically well, but it doesn't pay the bills at the end of the day for a lot of pediatricians and docs.
So as far as the protocols that get handed down. So this is one of the flows I like to make sure people understand is a lot of doctors don't get to make up their own treatment plans. These things come down from the NIH, the CDC, the FDA to the medical schools, and then are taught to the providers. And then that's the standard of care. And if a doctor steps outside of the standard of care, they can get in significant trouble. And so the education, what they're taught, how they're taught, what they're taught to do, what they're taught to use, all isn't a doctor really decision that much as it is FDA, CDC, and NIH. Is that flow more or less accurate in how informations and protocols are disseminated?
Yes, that's usually the case, and it depends on your institution as well too. If you're working within a hospital system, or your clinic or practice is owned by a hospital system, you really have to follow the protocols. Even if you want to, or you've seen better outcomes with other approaches, you're really not allowed to a lot of times go outside of that. And if you do, it's considered like off-label use, which, healthcare providers are supposed to have some autonomy with that and be able to utilize things off label, but it just depends on what that is that you're doing. A lot of times that can, cause a lot of scrutiny, or, people to kind of start looking a little further at you and things like that. But you should be able to, treat the patient, and it shouldn't be one size fits all. You should definitely be able to have customized, healthcare approach. It's not like this is the only antibiotic. What if you're allergic? Or what if there are other things that, like, what if you respond so poorly every single time? Is there nothing else that they can do for you? And that's, I think, the frustration for people. There's got to be something else I can do. That's what I think people are just hungry for.
Are there in that line, if you do step out, if you do something different, um, I know we hear a lot about the pressures that are on docs. Um, if you wanted to step outside that and do something different, um, are there negative consequences from licensing and from, the boards and stuff like that about, you're going to do what you're told to do from the FDA and the NIH. If you don't, we're going to take your license. We're going to do terrible things to you, because that's one of the things that you hear. And I just didn't know if that was how real that is.
Yeah, it's definitely real. We've seen people that has happened to, for sure. I've known several people that have, been reported to the board for certain things, and people are scared to draw attention to themselves, and I totally get that. I completely understand that. You want to do what's best for your patients, but you sometimes it's hard to live in the confines of this little tiny box when there are some other things out there that can be beneficial. So yeah, absolutely, that's true.
Okay. Because like that was what we saw during, and I think this is becoming a bigger and bigger deal. Like with COVID, and when people were talking about ivermectin, it won a Nobel Prize for people medicine. It's been given billions of doses and it's been phenomenally helpful. But because it was against what the narrative was supposed to be, it was demonized, and the people who were using it were demonized. Joe Rogan's not even a doctor, and they ripped him to pieces for saying, I took something and it made me better. So, that type of a thing, from when I talk to my friends, and they're like, oh, I can't talk about this, I can't talk about that, I can't do these things because, I'm going to get, I'm worried about what's going to happen to me. Those are the things that make me really sad, that, because like when I tried to get on and talk about COVID, when I put out the treatment protocol that I was using, it was working. It destroyed my social media reach. I got shut down. Like, we were getting pretty good results and it was nothing for a while. So, I see it from that standpoint, but it's got to be really, really difficult for a lot of these docs who are trying to do the best thing they can and trying to say, hey, this medication or this protocol, we could do better. But because, and this is what I see with statin drugs a lot, the idea that cholesterol is the bad guy, and so we have to use statin drugs to push back against cholesterol, is we have lots of research showing that is 100% wrong. But it's still the standard of care. And so if you don't, I know docs, I've talked to my cardiology buddies, and they're like, I got to put them on a statin. I'm like, why? And they're like, because that's the standard of care. If they have another heart attack and I don't put them on a statin, I get sued. And I'm like, but it's not going to help. They're like, sometimes that's not what happens.
Have you seen, I'm not an adult, healthcare provider by any means, but I don't know if you've seen this most current cardiologist that came out and was discussing the actual statistics on statin drugs and the percentage of people that it helps. It's 1%.
Yeah.
1%. And I'm like, that is ridiculous. But like you said, they're forced to put them on there. But 1% of people, if they knew that, with all the side effects, as you know, that statin drugs have on these people, it affects their life. They feel terrible sometimes in some cases, right? But if you knew it could only help at the most 1%, would you still want to do that? It's just, these are the logical questions that I think people sometimes, and healthcare providers sometimes forget to ask. Like, why, I have to, though. It's a protocol. Why am I doing this? Is it really helping?
Yeah.
So
And
I don't know.
that's the statin drugs are is kind of one of my big, issues, because whenever I work on dementia, the first thing I do is I got to pull them off their statin drugs, because your brain, people are like, oh, your brain's made of fat. It's made of cholesterol that your liver makes. Your liver makes
Yeah.
the cholesterol. Your heart runs on cholesterol. All your hormones are made of cholesterol. You can't heal with that testosterone, which is made from your cholesterol. So that's one of my biggest soapboxes. Like, that's my biggest issue. And I know there's other things in the peds world that, are irritating to people, but that's one of the things. Like I said, I talk to these guys and they're like, at the moment, there's nothing I can do. That's the protocol. Like, if they, I've talked to them, it's like, well, he had, this issue from a medication reaction. I was talking to a guy the other day, and I'm not going to name his name because he'll get in trouble, but the guy took a COVID vaccine, had myocarditis from it, and had an
Mhm.
infarct from it, had a heart attack, mild heart attack from it. And the guy has zero calcium score. The guy has no plaquing in his arteries whatsoever, but the doc put him on a statin because that's the protocol. And I asked him, I was like, how is that going to help him? And he's like, it's probably not. And I was like, then why'd you do it? And he's like, because if he has another one and I don't put him on the statin, he's like, that's a breach of protocol and I can get in trouble for it. So,
Yeah,
you
it's
know,
terrible.
and it is. So, well, thanks so much for coming in. Is there anything else that you'd like to throw out that, just make sure people know where to look for? Because not everybody's in Texas. Is there something that they should, look for, or try to get in touch with?
Just ask questions. Like I tell parents, if you're trying to pick a doc or a pediatrician, interview them, ask questions, um, read reviews online too. Talk to other parents. A lot of the people go online for social media, that it can be a benefit to that. Like, what are you seeing? Has anybody found these are things that are my health beliefs? Is there a local pediatrician in our area that has some similar beliefs? Those are kind of the best ways and resources that way too, just like even talking to other parents. But if just make sure you find somebody that's willing to have the conversation with you, just ask the questions, have the conversations, allow your choices that you want in approaches to your kids.
Well, thanks for being, well, first of all, being that person that I can always lean on and be like, hey, what's the best protocol for this or that? Because like I said, you've got more educate, you've chosen to get more education than 99% of any of the pediatricians that are out there. Because, if there's only 1,000 functional medicine trained docs,
Yeah.
percentages are
I need
low.
I need to look that number up. I'm curious now that you mention it, what that is. But I just love and appreciate everything that you do. And you teach me so many things all the time. I could never know all the things you know, but I am curious if you knew how many soapboxes you do have because I love them all.
There's
How
there's
many?
lots.
Yeah.
If I sat down to count them all, I think I would be irritated at how many. But it's just, it's one of those things where it's like, when you see something obvious, like, when we had all these hyperbaric chambers during COVID, and we didn't use any of them, and it was a low oxygen issue, and hyperbaric is designed to increase oxygenation of the tissue. It's physics. It's not even medicine. It's Boyle's law. Like, why do we not use these? Like, things like this irritate me to no end. When we have research that's 30 years old, like, we know how to treat addiction. We know how to fix it. We know how to fix PTSD. And almost 85% of the times, we've known this since the 1960s, but we won't use psychedelics because we have SSRIs to sell, and because that's not a big push for the pharmaceuticals. So, that these type of things, where I have so many, where I'm just like, why are we doing this so wrong? And that's been my issue for the longest time is, you know, we can fix things a lot better than we are if we just decide to take a little bit of the money or a lot of the money out of it. And that's the problem. So,
Sure. Well, you're
government's
doing
not.
great work for sure. Definitely making a difference. So I
Well,
appreciate
thank
that.
you so much. So, well, thanks so much for coming on. And if needs to get a hold of you, I'm sure that we can, get them through. What's the best way to, like, you have a website? Do you have anything that, you want to direct people to?
Yeah, we have a website, naturalchoicepediatrics.com. If you want to check that out, you can. Also, I love sharing another resource for people if you have questions. I know in pediatrics, a lot of people talk about immunizations and they have questions there. So there's a website called icandecide.org. If you have some questions, you want to look up research, they have a lot of great resources there. So icandecide.org is a great place to go as well. So best of
Fantastic.
luck.
that'll be a big one. I think everybody should, before you start choosing your pediatrician, definitely start going there and getting enough information that you know what questions to ask. So,
I guess I would say one other thing is Dr. Green Mom. She has a website out there too, and I think she has a list of like, healthcare friendly pediatricians on her website too across the US. So if you don't live in Texas, there's some other options there as well.
is there like a search for the IFM docs? Is there a way to kind of look for that?
I do think they probably do have that as well. A lot of those are more adult based, not necessarily pediatric based, but I can also, the med maps or maps, I can share that with you if you want to link that in your
I
notes too. I
will.
can send that information. That's a great resource as well for pediatric, especially special needs, autism, things like that.
Perfect. Awesome.
Yeah, I'll
Well,
send
we
you
will,
those.
yeah, we'll put them all in the show notes. So, Christy, thank you. Dr. Potter, thank you so much for sitting in and chatting with us. Hopefully we get some people who can start learning to ask better questions and find better healthcare for their kiddos.
Sure. Thanks for having me on.
Absolutely.
Bye.
Bye.